I'm Dr. Patrick O'Shaughnessy. Thank you for joining us for today's episode of CHS Presents Health Connect. Catholic Health Services of Long Island is an integrated healthcare delivery system with some of the region's finest health and human services agencies. CHS includes 6 hospitals, 3 skilled nursing facilities, a regional home nursing service, hospice, and a multi-service community-based agency for persons with special needs. Under the sponsorship of the Diocese of Rockville Center, CHS serves hundreds of thousands of Long Islanders each year, providing care that extends from the beginning of life to helping people live their final years in comfort, grace, and dignity. CHS has a commitment to high quality, and through this show and many community health initiatives, we aim to promote good health and provide you access to the care that you may need. I'd also like to thank and recognize each of CHS's 22,000 employees and affiliated medical staff members for their ongoing commitment to quality and service excellence, which is evident at each and every patient encounter. You are the face of CHS, and we thank you all for all you do for our patients and residents every day. In the United States, 82,000 women are diagnosed with gynecologic cancer annually. Each gynecologic cancer is unique, with different signs, symptoms, risk factors, and prevention strategies. At Catholic Health Services, our gynecologic oncologists are dedicated to their field and to achieving the best outcomes for their patients by assisting them on their road to gynecologic health. From prevention to treatment, delivering the best technology, expertise, and high-quality, compassionate care. Some gynecologic cancers are known as silent killers because women are often unaware of the signs and symptoms, or symptoms do not present. Cervical cancer is the second most common cause of death by women in the United States. And as I mentioned before, ovarian cancer, many times by the time a woman has symptoms, it's already progressed to a more aggressive stage of disease. To speak more on today's topic of gynecologic oncology and the award-winning oncology care at Good Samaritan Hospital Medical Center's Cancer Center, I'll be joined by Thomas Okers, the Executive Vice President and Chief Administrative Officer of Good Samaritan Hospital Medical Center, and Dr. Pankaj Singhal, the CHS Chairman of Obstetrics and Gynecology and Chief of Gynecologic Oncology and Women's Health Initiatives at Good Samaritan Hospital. For the latest in how CHS offers quality care for women facing this disease, stay tuned for today's episode of CHS Presents Health Connect.
As farmers and ranchers, stewardship of the land comes naturally. You help keep water clean, improve the soil, and provide habitat for wildlife. But did you know that conservation can also improve your bottom line? Learn more at conservationpays.org.
Hello, and welcome back to CHS Presents Health Connect. Women are at risk for gynecologic cancers, and risk increases with age. Today, we will offer expert advice in the prevention, diagnosis, and treatment for women who may be affected. Joining me now is Thomas Okers, Executive Vice President and Chief Administrative Officer at Good Samaritan Medical Center. Welcome, Tom, and thank you so much for being on our show today. Tell us a little bit about Good Samaritan. It is one of Catholic Health Services' largest and most prestigious facilities. Can you tell us a little bit about the hospital and the area that it serves?
Sure, it'd be a pleasure. Good Samaritan is a teaching hospital, a large teaching hospital. 437 inpatient beds with a 100-bed nursing home in Sayville, the main hospital located in West Islip. We have 4,000 employees, all dedicated and proud to work for Good Samaritan CHS, and almost 800 medical staff, and a very large emergency service, both in pediatrics and adult.
And you classified Good Samaritan as a teaching hospital. Can you describe for the viewers at home a little bit about what that means? You mentioned some of the residency programs.
Sure. Well, we have 8 residency programs. We teach 75 residents at any one time in a number of specialties. And then we also have nursing education and allied health education going. So it's an important part of our mission. And I think that patients benefit because we have to keep on top of our game. If you're teaching, we have faculty there, and our equipment is all state-of-the-art so that we're doing a good job teaching, and of course that benefits the patient.
Can you share a little bit about some of the services that Good Samaritan offers by service line?
Sure.
Pretty comprehensive and wide span.
Yes, so we're proud of everything that we offer. I'd like to highlight a few of them today. Our open heart surgery program, which is a St. Francis surgery program at Good Sam, has been a real success. Our outcomes are the equivalent of the outcomes that they have at St. Francis in Roslyn. It's been a very popular service. I hear about it from the community and from our medical staff. So that's an exciting program that's now, we've got a couple of years now under our belt, and again, we're very proud of that. We have a really large pediatric commitment and pediatric program. We have our own pediatric the emergency department.
Yes.
And trauma center, the only one of its kind on the South Shore of Suffolk County. We have a beautiful inpatient pediatric unit. We have a pediatric intensive care unit. We have a neonatal intensive care unit. And we have a pediatric outpatient center in Babylon. And we take care of kids who have long-term therapies, children who have perhaps medication or therapy that they're receiving over a long period of time. We support them as well through our pediatric program.
Yeah, that's wonderful. And you're also a level 2 trauma receiving facility as well and have
We
pediatric
are.
capabilities within that span.
Yes, we are.
And for our viewers at home, Good Samaritan really is our Suffolk County tertiary hospital. We have St. Francis in Nassau and certainly Good Samaritan in Suffolk County, and with the breadth of services that are provided by an incredible dedicated team of nursing team and also medical staff members, as you mentioned.
Right.
So wonderful services within the hospital, but we're talking a lot about also how can we get outside of the hospital and some of the preventive services. And can you share a little bit about what Good Sam is doing in the ambulatory preventive space?
Sure. Well, just to get back to the hospital itself for a second, our cancer program has been recognized by the American Cancer Society for the last 12 years as an outstanding achievement. And we are moving that program outside.
Perfect.
So that we know the future is going to be ambulatory care for cancer, and so that's work that's underway. Our radiation therapy program, which is an integral part of our cancer program as well, has won awards, and it's an outstanding component of our cancer program. In addition to oncology, we're out in the community. We have facilities. You can't drive very far from the hospital without seeing the Good Samaritan CHS name on one or another facility, in rehabilitation, in digestive health, in primary care, in cardiology, on and on. And then we are providing preventive education and screening throughout the community. We have something called Healthy Sundays. We're out in the parishes. We're in schools, we're in fire departments, and we're educating, we're screening, and I would invite any agency or organization that's watching us today who wants for us to do that for them can contact us, because we'd be happy to do that for them.
That's wonderful. You're such a vital part of the community, and I've watched the evolution of Good Samaritan from being always an incredibly high quality hospital-based program, now really branch out into ambulatory services. And I think your description of the high-quality oncology service line that exists along medical oncology, radiation oncology, surgical oncology, all at Good Sam, now that's being moved into an ambulatory environment and really to provide those same services in a more relaxed, comfortable setting for our patients. So that's just some wonderful developments. And let me ask you another question. Tell me a little bit about at Good Samaritan, since we're getting into, and we'll have Dr. Singhal on in a moment, for oncology and gynecologic oncology, have you seen changes in how technology-wise some of these services are being delivered now at Good Samaritan? You also have a robotic capability, is that correct?
We have robotic capability. We have the Da Vinci robot. I don't get to see it in action myself very often, but I know it's used. You know, our pathology and our laboratory backup services for oncology are very advanced technologically. Certainly you mentioned the radiation therapy and our diagnostic capabilities. All of them are tools that the oncologists and surgeons have available to them
That's
at
wonderful.
Good Sam.
I always say it's the best people
Yes.
developing the best processes and giving them the best technology available to deliver the best outcome for the patient.
Right. The other important thing to recognize, I think, with oncology and with other services as well is the navigators and the nursing staff that actually guide our patients through the process, because it can be challenging and complex for a patient. The fact is that the boots on the ground at Good Samaritan are outstanding and have really, I think everybody, including the medical staff, appreciates the efforts that they put in.
I want to thank you and thank the whole team at Good Samaritan for the great work that you provide for the patients in the community. And thank you so much for being on the show today.
Oh, well, you're welcome.
Thank you. We have to take a quick break, but we'll continue our discussion right after this.
Once there was a boy who did the same thing again and again. One day, he was told he had autism. He got help and slowly learned how to live with it better.
Early intervention can make a lifetime of difference. Learn the signs at autismspeaks.org.
Welcome back to CHS Presents Health Connect. In America, every 6 minutes, a woman is diagnosed with gynecologic cancer. Joining me now to discuss how women can reduce their risk is Dr. Pankaj Singhal, the CHS Chairman of Obstetrics and Gynecology and Women's Health Initiatives and Chief of Gynecologic Oncology at Good Samaritan Hospital. Welcome, Dr. Singhal, and thanks so much for being on the show.
Thank you, Dr. Shaughnessy.
It's great to have you here. Now, is it true nearly half of gynecologic cancers could be preventable? So what are some ways that folks at home could learn to reduce their risk?
It's an excellent question. Growing up in India in a large family, being youngest member of the family, I remember being in 6th grade, my mother had ovarian cancer. I don't think I ever talked about this to anyone, and talking this on a camera in big audience is very personal for me. And at that time, I started to think about why do people develop cancer, and if there is anything could be done to prevent it. And that is one of the reasons I was very passionate, and I'm being a GYN oncologist in women's health today. I think it's a very common belief that cancer occurs as we age, as we get older, the cells divide. As cells divide, they make mistakes, what we call mutations. And as mutations accumulate, they will develop cancer. However, this notion has been challenged recently. What we believe that external factors, such as how do we live, how we eat, how do we treat our body, has major impact on development of cancer. And in fact, recently, more and more we believe that by being healthy, by diet, by exercise, by not smoking, by cutting alcoholism, we can decrease at least up to 60 to 70% of all cancer. I'll give you an example. I'm dating now back in 16th century in Great Britain. People used to talk about chimney boys. I don't know if you have heard about them. They developed scrotal cancer. And that developed because they were sweeping chimneys. And later on we found out that was from coal tar exposure during sweeping chimneys. Back in 1990s, we saw massive increase in lung cancer. And we now know that was due to smoking. lately, lung cancers have declined because of decrease in smoking. Now, when we talk about particularly ovarian cancer, endometrial cancer, specifically uterine cancer is associated with obesity. Obese patients, they have higher estrogen, they have diabetes, they have hypertension. So if they decrease their body mass index, they keep their body mass index less than 25, if they control their diabetes, control their hypertension, they can decrease the risk of endometrial cancer, uterine cancer by at least 52%.
So that's incredible. So just doing a lot of the things that we hear almost every day from every agency. Eat well, exercise, don't smoke, moderate to small alcohol intake at best, and seeing your healthcare provider for regular checks could actually have a major impact in reducing the incidence of oncologic disease.
Absolutely.
Well, that's incredible. And, while that is certainly a huge benefit, unfortunately, there still will be patients that will develop cancer. And I think, part of the paradigm is increasing earlier preventive measures and detection, and then getting into earlier diagnosis and treatment. So can you share a little bit about how you've seen your field evolve from some of the new diagnostic methods and testing algorithms that have made an impact? And to share from another example, we've seen along GI malignancies, colorectal cancer rate drop tremendously, which is due to a lot of the things that you mentioned and earlier screening and prevention and treatment with colonoscopy. How about in your field?
Screening test in gynecologic malignancy has made huge difference only in cancer of cervix. Cancer of cervix in worldwide is about 500,000 people will die in developing countries such as India, Pakistan. But in US, only about 9,000 patients are diagnosed because we have excellent screening such as pap smears. Now, for ovarian cancer, there is absolutely no screening test. When I say there's no screening test, majority of the patients are asymptomatic. Patients have symptoms which are very non-specific. Majority of the patients will have, and again, if anyone who is in 50s, 60s, 70s has symptoms such as bloating sensation, they have acid reflux, they feel full after eating food, they have urgency to go to the bathroom all the time, they have been treated for urinary tract infection, they must see either the primary care physician or the gynecologist, or must see a GYN oncologist. These are very non-specific symptoms, but these are
the early symptoms.
Very early symptoms.
And many times they get missed.
Up to 1 year before someone is diagnosed for ovarian cancer. Now, when we talk about uterine cancer, and I wanted to talk about genetic predisposition in a minute, but most of the patients with uterine cancer, they have bleeding after they are in menopause. And bleeding is bothersome enough that they will go and see one of their physicians, and that will lead to a biopsy of the uterus and subsequent diagnosis. So majority of the patients with uterine cancer may be detected in stage 1, that is early stage.
Correct.
But a lot of the patients, they need to recognize the fact that even a drop of blood, even a spot of blood when they're in menopause needs to be investigated. They need to go and see their physician right away. It's not normal, it's abnormal. That may be a sign that there is a problem.
So needing to get that appropriate care. Now, we talked a little bit about environmental factors, but I know you want to mention some things that, up until now we still don't have control over, which is genetic predisposition. Can you talk a little bit about the genetics of cancer and specifically within your field?
It's extremely important to know their family history, and particularly type of cancer. If they had breast cancer, colon cancer, uterine cancer, brain cancer, kidney cancer, any type of cancer, and not just type of cancer, at what age they were diagnosed.
And so genetics actually can give you some headway into earlier detection and then more aggressive earlier management. Before we leave the segment, I do want to share a little bit and have you talk a little bit about your surgical expertise. So when patients are caught and they do unfortunately have something that needs to be corrected, in the skilled hands of a surgeon like yourself, can you talk a little bit about some of the approaches and techniques, whether it be robotics or even traditional laparoscopic surgery that could help a patient?
So, as a surgeon, I think surgery is nothing but it's an injury to, if I'm having a surgery, it's an injury and insult to my body. The question is how much insult and how much injury do you want? And that translates, more injury translates to more recovery. So if I were to have an operation on myself, if I have a big incision, means I need 6 to 8 weeks of recovery. That big incision needs more time to heal. And in cancer field, it becomes more important because if I need radiation or chemotherapy, means I may have to wait 6 to 8 weeks or even 10 weeks to start treatment. In cancer field, it's even more important to start treatment within 2 to 3 or 4 weeks because leftover cancer could start to grow. Small incision, especially with robotics or minimally invasive surgery, allows you much faster healing that you could start your treatment sooner. Now, keep in mind, robotics surgery, I compare robotics to flying. If you have twin-engine plane and you give that pilot a Boeing 757, they will crash. So it's extremely important if someone is looking to have minimally invasive, specifically robotic surgery, you want to have someone who has done thousands of these surgeries, not just few hundred. You wouldn't want someone to fly a jet fighter plane or 757 without having 10,000, 20,000 hours flying experience.
And so can you speak a little bit about your experience set and the amount of time that you've had in this area?
As of now, since 2009, and now I have done close to about 2,800 surgeries myself.
2,800 surgeries
That is
yourself?
correct. Now, in United States, in GYN oncology, we are approximately 1,000 board-certified surgeons in the country. Among all 1,000 surgeons, I would say probably there are about 25, 28 surgeons who has performed as many surgeries as I do.
In the country?
Yes, sir.
Yeah. So, I mean, this is just a wonderful opportunity for patients within our system to have you be available to them in this capacity. We are out of time, but I do want to thank you for coming on the show and sharing with us some of the preventive and genetic components of oncology and specifically how our viewers at home could perhaps learn on some of the preventive areas to keep them healthier. And I want to thank you and wish you the best of luck in our system. I know you're going to do a great job. Thank you for being here. We'll be right back. So I'd like to share some final thoughts on today's topics for our viewers at home. I would like to first recognize and again thank Dr. Pankaj Singhal and Mr. Thomas Okers for their segments today. And for our viewers at home, do please go on the Good Samaritan Hospital website and review the wonderful breadth of services that are available, from open heart surgery to the preventative services and pediatrics and women's health. And as you heard Dr. Singhal specifically speak to, there is so much we can offer today in terms of women's health initiatives and preventive services to try to get upstream from disease. And that's really what I wanted to talk about as we wrap up this segment. Sometimes folks are so afraid of a symptom they may have. They may see a drop of blood. They may have an uneasy feeling in their stomach or a feeling of bloatedness, as Dr. Singhal shared. Go get that evaluated. Many times, if it's a benign issue that can be easily resolved by your primary care provider, but in the unfortunate circumstance that it's not, you have the benefit of catching something early on. And with the advent of new technologies and new testing paradigms such as genomics and other tests that we can do, we can better risk stratify you and find out about these problems earlier and get you on a path to health and wellness. And now for my health tip and solution. I'd like to talk a little bit about infection prevention. And this is an area that comes up all the time. I get questions asked of me all the time regarding how do I avoid getting sick, Dr. O? And I'd like to share with you some concepts around basics such as hand hygiene and how to adequately disinfect some key areas. And let's talk about one key thing about when we all travel. And we love to travel to beautiful locations, visit family and friends, but most times that requires getting on an airplane. And I've heard all too many times well, you know, I shouldn't have had the air on the airplane and have that blowing on me. That's what got me sick. I'd like to dispel that myth, and I'd like to share with you that it's not the air in the aircraft that gets you sick that's being recirculated. That's 50% fresh air from the outside and 50% air from the inside that's actually HEPA filtered. It's actually you touching the fomites, or what fomites are inanimate surfaces like countertops or your tray table or your seat buckle. And as my wife and I always joke about, 9.9 times out of 10, there's someone sitting directly behind me that's got a cold or a cough. And so as a sneeze or a cough comes out, up to 30,000 particles could actually land on all those surfaces and can actually stay viable, meaning be alive, and infect you for up to 24 hours. And the airlines, they don't disinfect. They clean the airplanes, but they don't disinfect. So what's my tip? Take out some hand sanitizer, or if you have the hand pack wipes that are alcohol-based, wipe down everything. Wipe down your seat buckle, wipe down your tray tables, wipe everything down, and actually do put your air on. And if you do have the unfortunate circumstance of having someone behind you who's not feeling so well, put the air on and actually blow it towards you, because it'll help keep the germs back in that section behind you. And that's my tip for today. If you'd like to know more about how CHS's women's health initiatives, or to make a gift in support of this or another program that is important to you, please visit chsli.org. From there, you can click through to the websites of each of our healthcare partners for more information on ways to give. We are always grateful for the community's support, because your gift today helps shape the healthcare of tomorrow. Thank you for watching today. If you have any medically related questions you would like for me to answer on future shows, please do drop me an email at healthconnect@chsli.org. Please include your name and a way to contact you in case we need to reach you. I'm Dr. Patrick O'Shaughnessy, and I hope to see you next time on CHS Presents Health Connect.